Has this happened to you? All of a sudden, your foot starts to hurt seemingly for no reason. You haven't injured yourself. You're limping, life is difficult and painful. You may even have trouble going to sleep at night because of throbbing, aching, or burning. What in the world can this be? Hi, I'm Dr. Gaffney, and I'm going to share with you the common areas of the foot that can hurt seemingly for no reason. And I'm going to break it down to the top 5 areas of the foot and point you to helpful resources to help you stop that pain. In the end, I'm going to share with you 3 simple ways to prevent foot pain to begin with. Hi, I'm Dr. Gaffney from Dr. Gaffney Best Foot, helping you save time and money in your foot care decisions. So although it may seem like this foot pain came out of the blue and happened all of a sudden, what I've typically seen in my practice as a podiatrist is that these foot problems kind of slowly build over time and fly under the radar until they reach critical mass and finally get your attention. So it's important to see your podiatrist if you have pain going on, because my point is this has probably been slowly building without your knowing it over time. And it's just important to see your podiatrist to get it taken care of. So the top 5 areas of foot pain that can be caused without injury, and the first one is your heel. So you can either have pain at the bottom of your heel or the back of the heel. If it's on the back of the heel, it's usually related to a tight Achilles tendon. And when your Achilles is tight, that means you cannot bring your foot upward at your ankle enough, and that causes all kinds of problems in the foot. And locally at the back of the heel where the Achilles inserts, it can cause a bursitis, it can cause a bone spur, you can get little micro tears inside the tendon there that can cause pain. If it's on the bottom of the heel, it's usually related to plantar fasciitis, and that's a common foot problem that most everyone knows about, and it involves a tight ligament on the bottom of your foot that inserts at your heel and gets a lot of tension, strain, and pain with this type of condition. And the most common symptoms of this is pain when you first get up out of bed in the morning that goes away with walking. So please see my playlist and series of videos on how to stop plantar fasciitis. And this is important to treat early, and it resolves quickly if you treat this heel pain early. So number 2 is arthritis. And the 2 most common areas of the foot for arthritis is the midfoot and the big toe joint. When it's at the midfoot, it usually involves aging associated with someone with a flat foot and also someone with a tight Achilles tendon that we were talking about. So again, that tight Achilles tendon prevents your foot from coming up enough at the ankle, and that loss of range of motion is compensated in the foot and causes all kinds of problems, one of which is stress and strain at the midfoot, and over time that can cause arthritis. The second area of the foot with arthritis that is particularly hit is the big toe joint, and this is usually related to structural abnormalities, or you've had a trauma there, or you've had gout. So all your body weight goes through your big toe joint when you propel off and gait. So it's particularly subject to a lot of wear and tear throughout life. Please see my episodes on how to mitigate and alleviate arthritic foot pain. Okay, the third area of the foot that is a common cause for sudden pain without injury is the ball of the foot, or we call this metatarsalgia. Commonly, it's due to hammer toe deformities, and the hammer toes push your metatarsals against the ground, and you get a lot of pressure type pain down there. You can also get joint inflammation and bursitis. Another big cause of ball of the foot pain is a pinched nerve or a neuroma between the metatarsal heads, and that's where you get stinging, burning, electrical shocks, or feeling like you have a rock stuck on your foot. If you want some more information on how to treat a Morton's neuroma or a pinched nerve, please see my episode on that. Those problems I just talked about can be aggravated or caused by that tight Achilles tendon and not letting your foot come up enough when you walk. I just want to mention here another sort of uncommon cause of foot pain in the forefoot, and it's usually on top of the foot where you got a lot of swelling and intense pain, and that is a stress fracture. And it's not all that common, but if you have a swelling and pain on the forefoot area, it's important to see your doctor because the stress fracture needs to be treated. And also an important note about stress fractures, your first x-ray will probably be negative, but you need to have a follow-up x-ray in 10 to 14 days, and that usually will reveal the bone callus formation that identifies the stress fracture. So see your doctor if you have any pain or swelling on the top of your foot. As with any type of foot pain, you should be seeing your doctor. Hey, if I've given you some value, if I've helped you at all, please like and subscribe to my channel. I'd appreciate that very much. The fourth cause of common foot pain without an injury is deformities, and these are lumps and bumps of the foot like hammer toes, bunions, tailor's bunions. So these are bony deformities, and the only way to correct them long term is with the surgery, but there are many ways to accommodate the deformities to alleviate the pain. Most of the pain is usually caused by trying to shove these types of feet in shoes that are too small, and you get pressure type pain. Also, you can get joint pain too because the joints are malaligned. I've had many patients live with these deformities not needing surgery, but the key is try to accommodate them with proper shoe gear like an anatomical type toe box. The fifth common cause of sudden foot pain to the foot without injury is a nerve disorder or neuropathy, and this usually involves a systemic medical condition that affects the nerves to the feet. The most common one is diabetes. So neuropathy is the nerves not functioning right down to the foot. So the symptoms of neuropathy usually involve numbness, tingling, burning, electrical shocks. It's common to have burning pain keep patients up at night with neuropathy, but there's many medications and treatments to help with that. So please check out my episode on it. Okay, so here are 3 simple ways to help you prevent foot pain in the future. They're simple, but not easy. Well, the first one is avoid fast weight gain and also keep a healthy weight. With the fast weight gain, your body is not adapting to the extra load quickly enough, so your tendons, your bones, your ligaments aren't getting stronger with the stress. So they don't have enough time to get stronger, so that can lead to either like a stress fracture or tendinitis or any number of problems, arthritis especially. Number 2, do not wear worn out shoes. That puts extra strain and stress on certain areas of the foot and can get it flared up quickly. Also wear a well-fitted shoe so you don't have anything squeezing your foot, and try to wear a stable shoe, one that's not too flexible or worn out, and that will strain your foot as well. Cheaper slide on, and it has a it's glued together there and has a cardboard midsole, so it's not gonna last too long. It's also extremely flexible. You can fold it in half, and the heel counter is real mushy. And lastly, the exercise, in my opinion, that I think will keep your feet healthy is eccentric Achilles tendon loading. So this will keep your Achilles tendon strong as well as keep it stretched out so you have enough of that upward motion at your ankle to prevent all the downstream effects of the foot compensating for not having enough motion at the ankle, and that prevents all kinds of problems. So how you do that is that you get on the edge of the step, you put the ball of the foot on the edge of the step, you drop the heel down below the step and hold it there for a second or 2, and then rise slowly up onto the tips of your toes, and then go back and forth, and make sure you're holding on to something so you don't fall. But I do have an episode also on that, so check that out. Please see the full disclaimer in the description. This is not a doctor-patient relationship. This does not constitute medical advice, but is for informational purposes only.